In the graveyards of Gold Rush, Victoria, the reminders are everywhere. On headstone after headstone, the names of children who had barely begun to live. A century and a half ago, measles was a leading cause of death, a feared killer.
Around about the 1880s, we were seeing up to like 1,250 deaths in children under the age of 5 years, which was easily the age group with the highest mortality, and particularly children under the age of 2. So we're talking 5,000 to 6,000 deaths per year.
Along with diseases such as scarlet fever, measles devastated communities. Vaccine expert Professor Margie Danchin says in crowded cities and towns with poor sanitation, it spread quickly.
These first contact measles epidemics, where measles were coming into a completely naive, unvaccinated community, these were really enormous, big, severe epidemics that hit the community.
Since 1970, mass vaccination for measles has been remarkably effective. By 2014, the disease was considered eliminated in Australia, with no ongoing local circulation.
Aren't you wonderful?
Nice to meet you. Hi, very nice to meet you, please.
Victoria's Chief Health Officer, Tarun Weramanthri, says that designation has changed.
So measles is back. Case numbers have been rising across the world and in Australia.
17 cases have been reported so far this year in Victoria. That's the same number as all of last year. As epidemiologist Dr. Catherine Gibney explains, case numbers can quickly accelerate with measles.
It's the most contagious infection that we know of. So one person with measles, if they come in contact with a group of people who are not immune, can spread it on average to 18 other people. So it's very infectious.
The risks of serious complication from measles are high. 20% of children with measles are hospitalized, about 1 in 5. 1 in 20 children who contract measles develop pneumonia, the most common cause of death. And 1 in 10 children will develop ear infections, which can lead to permanent hearing loss.
Hello, gorgeous. Hello, gorgeous. Hello.
Shirley Humphris is concerned for her grandson Sully and the potential risks posed by the reemergence of measles.
Look, it's deadly for little people like this. It can give them brain damage, and it's just so surprising that there is a comeback, because we're from the generation that everybody had started to get really compliant with having the vaccinations they were supposed to have.
Victoria's Chief Health Officer says vaccine hesitancy has increased since the COVID pandemic, and that is having an impact.
Our vaccination rates now have dropped a couple of %, and that's crucial because we're aiming for herd immunity, which is 95% coverage of the population, and that really protects everyone if we get up to those levels.
Shirley Humphris says she's concerned about vaccine misinformation she sees online and on social media.
It bothers me a lot, the information that's spread around on the flimsiest or no credible research.
The measles case count continuing to rise and now in new counties.
Texas is an example of what happens when measles vaccine rates drop. Dr. Carla Garcia Carreno is an infectious disease specialist with the Children's Health System in Plano, near Dallas. The state's outbreak has now topped 500 cases, with 2 deaths.
So this is the biggest number of cases that we had in Texas in decades. So last year, the CDC reported 285 cases in the U.S. for the whole year. And we have already surpassed that number that was reported from 2024.
Vaccine skepticism is high in Texas and the U.S., and the new health secretary, Robert F. Kennedy Jr., was grilled about his views in his confirmation hearing.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines.
During the current outbreak, he's been criticized for failing to strongly support the measles vaccine.
If people don't want it, the government shouldn't force them to do it. There are adverse events from the vaccine.
Dr. Garcia Carreno chooses her words carefully when asked about the U.S. federal government's messaging on vaccines.
We need to keep, basing our recommendations on the robust science that is there, and it's been years of research. It's a challenging situation, but we need to keep educating the community.
Epidemiologist Dr. Catherine Gibney says consistent education about vaccines is also needed in Australia. In northern New South Wales and Queensland's Noosa hinterland, she says, measles vaccination rates are between 70 and 75%, well below the 95% needed for herd immunity.
There's perhaps a loss of confidence in vaccination since COVID. We were all overwhelmed by the pandemic and by all this messaging around vaccines and by vaccine mandates. And there's been a real change in attitude in some small sections of the population.
Beautiful.
At 3 months, Shirley Humphreys' grandson has to wait for his first measles vaccine, recommended at 1 year old. She believes it can't come soon enough.
There are so many kids who have been immunised, they're perfectly fine. There are kids with measles who have died. There are kids with measles who have been brain damaged. It's just not something to mess with.